In April of this year, at the American Academy of Neurology conference in Vancouver, British Columbia, there's going to be an important study discussed that looks at a population of Ebola survivors in West Africa. What it is specifically looking at is 82 survivors matched with paired controls to see if the neurologic symptoms that have resulted from the Ebola infection are really due to the infection or from some other cause. The findings are that the patients have are weakness, muscle pain, headache, some eye changes, depression, even hallucinations and suicidal ideation. So the question that they're looking at is it cause and effect that there's a resulting chronic Ebola survivor syndrome, if you will. The reason this is so important is that this has been observed, but only anecdotally in the past. There was a discussion in Lancet magazine in 2001, and then again another published study in 2007, but those were just case studies looking at a case here and a case there. You know, with all the vast number of patients in this most recent outbreak in West Africa, there is a lot of concern about a post-Ebola syndrome. And that's exactly what these researchers are looking at. What they found during the course of this study additionally are hard neurologic findings, tremor, ocular movements that are abnormal, tenderness to the muscles and the joints, things that would not be expected if a person completely resolved. And I think that really the important part of this is that if there is a chronic syndrome, really two questions come up. Is this because of it's an immunologic abnormality that has resulted from this, or is the person still carrying residual virus in their bodies? In other words, if we sampled every fluid reservoir, if you will, that there's still active virus. We know that even hundreds of days after a viral infection with Ebola, that the person, a man, can give it to a woman sexually, and that's been noted. So, very important to find out, is this cause and effect, that is, of the post-Ebola syndrome? The symptoms that they're seeing are higher than would be expected, but it has profound implications for the ongoing management of the post-Ebola patient.